Thank you very much, sir. I hope all of you can see the screen.
Yes, we can.
Okay, thank you. Good evening, everybody. So I would like to present the conceptual framework we have developed using a mobile application to support the COVID management. So as said in the previous presentation, there are several use cases of application or mobile app in supporting the COVID management in different countries. But still, we can see there is a requirement for development of a new apps. Now, the example, there are only 100 countries out of 200 countries around the world have using a mobile application to support COVID management. In other words, there are 50% of countries don't have any kind of a mobile application. There may be several reasons. One, they don't have a proper infrastructure, they don't have expert knowledge, or maybe financial issues. Other than that, we can see there's a new requirements are coming up now. Now we can see that there may be a new trend or new variation of the virus, and then we may need to travel the contacts across the borders. So like that, so new requirements are coming up. So to support these kind of new requirements, and especially with the new normal behavior, we have to develop new apps. So we thought of that, right? We have to develop a new app. So what are the approaches? So then we try to analyze different approaches. One is, can we develop the single app or the universal app for COVID management to support the COVID management? Then another option is, we thought of that rather than developing app, can't we develop an app development framework? So it's like a toolbox. We are not developing an app, but we are developing a framework. So using this framework, any country can develop their own apps. So these are the two options. So then we analyze these two options a little bit detailed. We did the SWOT analysis, and we see that each option have the pros and cons. So if you look at the universal app, so in a single app we are talking about. So developing a mobile app in these days is not a big task. So you can develop the mobile app relatively with a limited budget. We don't have very much expert developers and with a short developing cycle. However, we know that it's not possible to include all the requirements into a single app, because different countries may have a very different or unique requirements for their mobile apps. So we can't put all these requirements and put into a single app. So that is the main disadvantage we can see if you are going for a universal app for the COVID management. The second option we thought of that app development framework. So the framework development is it's a much bigger task compared to the mobile app. So it will take some time. You need to have a more budget, and also you need to have some kind of a more expert developers. But we can see there are some opportunities and strengths. So one is that we are not developing an app, but we are developing an app framework. So any country, you can use their requirements with this framework and develop their mobile app. And other important thing is, this framework not only for the COVID, we can use this framework to other pandemics as well as other diseases, expand to other diseases as well. So that is the advantage. So comparing these two options, finally we thought that we will go for the developer mobile app framework rather than mobile app. Right. So the next question is how we are going to develop the mobile app framework. So again, we can have two approaches. So one is we can develop a unique framework for the health sector from the scratch. So then the issue is that developing a framework from the scratch is a big task. So you will have to have a big, you will have to relatively have a large budget, and it will take a long time. You have to do the proper requirement analysis, to testing, and then identify the bugs and piloting, a lot of time. So it will take some time. So the second option is, rather than developing a unique framework, can't we use the existing frameworks? Now, if you look at the world today, so there are a lot of mobile app development frameworks are there. Now, as an example, the Flutter maintained by the Google, and there's a React Native maintained by the Facebook, and then Xamarin by Microsoft. So these are open source and generic frameworks. So generic means these frameworks, using these frameworks, you can develop any sort of app, whether it is for the education industry, whether it's for the health industry, whether it's for the transportation industry, whatever industry, because these are very, very generic frameworks. So what we're suggesting is, take this generic framework, and using this framework, we will create the health specific layer on top of that. And using that, any country can develop their own mobile app to support the COVID management. So that's what we are suggesting. So this is a very simple example what we are suggesting. As you can see, there is a core framework, and also we are proposing something called the plugin repository. So these plugins are, it's like a functional list. So we will, it is a predefined functional list. We will create the repository and core framework. So if a country A want to have their framework mobile app, so they can use the core framework with the required functionalities according to their requirement, and come up with their framework, come up with their mobile apps. And so that is another advantage is that, so because if you are using the similar same framework, the back end of this mobile app also, we can have a standardization. So they can even, it may support the data sharing from the different countries as well. So that's what we are suggesting. So what I mean by plugin is, now you know that this framework has a predefined code. We call that widgets or the components. These are the reusable code set. But they are general purpose. Like the example, they have a text widget, they have a column widget, they have a video widgets, like that. So what we want to is, we will use these generalist widgets and we put them into as a plugin to do a proper task. Like this example, if you want to have FAQ plugin to provide the health information, we will divide the FAQ plugin using this predefined or the already available widgets in that framework. So that's why we call it as a plugin. I will explain that in later also. Right. Now, how we develop the framework. So we follow these steps when we develop in this conceptual framework. First thing is, as I said earlier presentation also, we did the literature review to identify the different what are the capabilities that are required to the end users to support the COVID management. So we have identified 10 capabilities at the end of these exercises. Out of 10 capabilities, we saw that planning management and the knowledge management are supportive for the healthcare providers. But these frameworks, we are mainly targeting the end users, that is the general public. So we omit the 2 capabilities, and we are focusing other 8 capabilities to support using the mobile app. The second exercise what we did was, we want to map these capabilities to the digital health interventions. Now, these digital health interventions, I'm sure you are aware that the WHO published this digital health intervention document in 2018. So they have mentioned the different intervention we can do to different stakeholders to support digital intervention to support their day-to-day activities, like healthcare providers, clients, health administrator, and data services. So they have listed different interventions. So next, in this exercise, we identify the one capability and we map the related digital health intervention to this capability. So at the end of the exercise, we create this DHI, digital health interventions capabilities map. In developing this framework, as a third exercise, we now need to identify the more specific services. Now the example, let's say we have one capability called the vaccine management. Then we map this vaccine management capability with WHO interventions. Let's say that there is an interventions called transmit untargeted health information. So it's a generic intervention. So we want to identify what is the specific services user need. Now, in this example, user may need to get the vaccine related information, news. So that's kind of a service. So like that, we listed all the related services at the end of this exercises. Now we have the list of services as well. Now the fourth step, we see that we have a list. Now we can group this list and put them into as a plugin, as I mentioned earlier. So we identify the related services and group them as a plugin. And at this exercises, at the end of this exercise, we have identified 21 plugins like news portal, maps and location, service enrollment, contact tracing, vaccine management. These are the plugins. So we will identify this plugin to provide the different services related to COVID management. That's our fourth step in developing this framework. And the final step is, now again we see that now we have identified the capabilities, for example vaccine management. Now to get that capability, you need to have more than one plugin, because you need to get lot of services. So we try to identify what are the related plugins to particular capability. So like that, so we have we will identify these related plugins and put that as a library. So we have 8 capabilities, and then we have 8 plugin libraries related to that capability. So that's how we have developed this framework. So this is a high-level diagram of this our framework. So I'll explain it briefly. So now the actor means the end user, that is a normal person in our community. So he may need to get different capabilities. Let's say it's a vaccine management. So he will have a mobile app. So in mobile app, he will get this functionality through a plugins. So this plugin actually have 2 parts. So the front end plugin is with this mobile app. So it will communicate it is the backend plugin and the mobile app backend. Another important concept we want to highlight here is, now we know that COVID management is not just a health system or the health department duty. So you need to get services from different stakeholders. It may be the education ministry, or there may be a defense ministry, or maybe other essential services. So a lot of stakeholders have to come up, and as it's actually multi-sectorial approach you need to have. So we need to support that part. So now let's say that, so there are maybe a global digital health like DHI services may implement different services to provide the particular services to the user, or there may be a pharmacy services to provide the drug distribution during the COVID lockdown. Like that, there are maybe different services. So what we are suggesting is this backend have a different layer called the API orchestration layer. So it will communicate with the different backend services as a data services and get their services, and through this API orchestration, it will direct these services to a particular plugin. So then user can get the related services at the end. So that's the main idea of this framework. So now this is one example. Now, as I said, this is the vaccine management. This is one capability we have identified. So related to vaccines management, so user may need a different service, like user may need to get the news or information about the vaccine. Then user may need to get the information about the vaccine centers, where their locations, and they may want to register the vaccine services and get the appointment. And then he may go to the vaccine center after the vaccination. He may need to update his immunization status, and also he may want to access the vaccine certificate, like that. So this sequence diagram represent that. To provide or to get all these services, he need to have a different plugin. So that is what listed above in the yellow color. So in the vaccine management capability, you have a plugin library of consist of this messaging plugin, news portal plugin, service enrollment plugin, vaccine plugin, and health certificate plugin. So like that, we will have a separate plugin libraries for other capabilities as well. So in our framework. Right. So that is very briefly about our framework, and this is a last slide. So now when come to this is a conceptual framework, but now when we are coming to the development or the implementation of framework, yes, there are some challenges. One is you need to identify proper resources and development team developers and like that. And we are collecting the health data, so obviously there may be a security and privacy concerns, so we need to have an address. And also different countries have a different attitude regarding the mobile app usage, and these issues need to be addressed. But if you look at the scope of that, I think there are a lot of opportunities we have to consider. So one is, as I mentioned, so most of the data-driven companies in today, like a Google, Facebook, they have already the framework. So there is ideal opportunity to collaborate with them and get that framework and do the customization to develop this mobile framework. I think there's a big opportunity there. Another thing is that, so we can not only the COVID, so we can use this framework to any other future pandemics as a rapid response, because the methodology is similar. More than that, this framework can be expanded to other health areas like cancer patient. So methodology is very similar. You have to identify the capabilities required for the patient and then develop the plugin bundles, and you can come up with the app or the NCDs. So as you can see, so there is a lot of opportunities if using this framework. So finally, I have to say that, so if you can get required resources, and if you have find proper collaborations, I think we can do lot using this mobile app framework for the health sector. So thank you very much for listening.